Good evening, everybody. In today's class, let us try to learn about the pharmacology of hydroxyurea and L-asparaginase enzyme. So, this is the 19th day of our Basics of Oncology and Chemotherapy 30-day course. So, let us try to discuss about hydroxyurea, the pharmacology, basic points about hydroxyurea and L-asparaginase. Okay, so let's begin the session. So, before understanding about hydroxyurea, yes. See, hydroxyurea has few important points to be remembered. Very, very important points. Important points about hydroxyurea. Hydroxyurea is also called hydroxycarbamide. Hydroxycarbamide. Now, let me tell you some important points about hydroxyurea. See, hydroxyurea has diverse biological effects. It has wide variety of pharmacological actions. In that, always remember hydroxyurea has three main pharmacological actions. Always remember these three main pharmacological actions of hydroxyurea. In that, the first important pharmacological action of hydroxyurea is it has anti-leukemic action. It has anti-leukemic action. That's why it is mainly used for leukemia. Very, very important point. First point. Hydroxyurea has three major pharmacological actions. In that, first one is it has anti-leukemic action. That's why it is used in leukemia. Okay, first point. Second important characteristic pharmacological action is it is used as radiation sensitizer. It is used as radiation sensitizer. It sensitizes the neoplastic cells to the radiation. Okay, whenever a patient is having radiation therapy, along with radiation therapy, hydroxyurea is used in adjuvant therapy along with radiation therapy. In that cases, what hydroxycarbamide does, hydroxycarbamide will increase the sensitivity. It increases the sensitivity of the cells for the radiation. Okay, and by that the cell will easily die with radiation therapy. That's why hydroxycarbamide or hydroxyurea is used as radiation sensitizer. This is second pharmacological action, second therapeutic use of hydroxycarbamide. And next, very, very important, the third pharmacological action of hydroxyurea is hydroxyurea is used in sickle cell disease. Sickle cell disease. This indication is widely used in hospital. I will try to explain about this indication in detail. Simple one point. Hydroxyurea is used in sickle cell disease. Why it is used in sickle cell disease? Hydroxyurea will induces the production of hemoglobin F, or it helps in production of fetal hemoglobin. Okay, so about these all concepts I'll explain now. See, always remember, I think you understood these 3 points. First, hydroxyurea has wide pharmacological actions because it is a diverse biological agent. It has anti-leukemic action. That's why it is used in leukemia as anti-cancer agent. It is used in radiation therapy because it is having radiation sensitizer action, and it is also used in sickle cell disease because it induces the production of hemoglobin F in the sickle cell patients. Now, I will try to explain you about the significance of hemoglobin F. Okay. Now you see, before understanding about sickle cell disease and all, let me tell you some types of hemoglobins. There are so many types of hemoglobins. Types of hemoglobin. Actually, I have discussed all these points in sickle cell anemia and while we discussed about anemia, but still, let me revise all these points. First one, see, there is a hemoglobin called hemoglobin A. Hemoglobin A is also called adult hemoglobin. Okay, adult hemoglobin. This is the major form of hemoglobin which is present in most of the adult population. See, we all have RBC, erythrocytes, we call them erythrocytes. All RBCs will contain a pigment which is called hemoglobin. Okay, hemoglobin pigment has four. It has four chains of amino acids. It has four chains of amino acids. Hemoglobin has four chains of amino acids. In that, two are alpha 1 and alpha 2, and two are beta 1 and beta 2. Each chain of amino acid contains one heme. Each chain of amino acid contains one heme, and in each heme molecule we have one ferrous. We have one ferrous molecule. These are very basic things we already know. Hemoglobin is the pigment, protein pigment, which gives red color to the RBC, right? It gives red color to the erythrocyte. And this hemoglobin is important in binding oxygen, and that's why it is useful for exchange of oxygen and carbon dioxide, particularly oxygen, to all the tissues of the body. If anybody's hemoglobin decreases, it causes anemia. These are points we have already discussed. Now you see, hemoglobin A is the adult hemoglobin. Adult hemoglobin is that hemoglobin where the hemoglobin has two alpha chains, alpha 1 and alpha 2, and two beta chains. Hemoglobin A is that hemoglobin which has two alpha chains and two beta chains. Okay. And next, there is another hemoglobin called hemoglobin hemoglobin C. Hemoglobin C. Hemoglobin C is a type of hemoglobin in which actually see in one beta chain of the hemoglobin. Just imagine this is a beta chain, one of the beta chain of the hemoglobin, and this beta chain has many amino acid chains. Okay, it is made up of different amino acids. On the sixth amino acid in the normal hemoglobin, in hemoglobin A, if the sixth in normal hemoglobin A, the sixth amino acid is glutamate. Sixth amino acid is glutamate. The sixth amino acid is glutamate in the normal hemoglobin. Hemoglobin C is a type of hemoglobin where the sixth amino acid glutamate is changed or it is replaced with lysine. That is called hemoglobin C. Hemoglobin C is that hemoglobin where the sixth amino acid of the beta chain is changed. It is replaced by lysine. Lysine. Simple. And there is another hemoglobin which is called hemoglobin E. Hemoglobin E. Hemoglobin E is the hemoglobin where in the normal hemoglobin of the beta chain, the 26th position of hemoglobin, on the 26th position of hemoglobin, again there is glutamate. Okay, this glutamate is again replaced. The 26th glutamate is replaced by, it is replaced by lysine. Lysine. That's why it is called hemoglobin E. And there is one more hemoglobin which is called hemoglobin S, or which is also called hemoglobin sickle cell hemoglobin. Okay, so hemoglobin S is that hemoglobin where the sixth amino acid of the beta chain, if one of the beta chain is having glutamate, right? This glutamate is replaced. It is replaced by valine. So hemoglobin S, hemoglobin S is that type of hemoglobin where the sixth amino acid, which is glutamate, is replaced by valine. See, in hemoglobin we have two beta chains, beta 1 and beta 2. If on the beta 1 the sixth amino acid is changed with valine, then patient's one beta chain is having mutation. That's why it is called hemoglobin S. And if the second beta chain, again on the second beta chain also, if sixth amino acid glutamate is again replaced by valine, then the patient becomes HBSS. So two chains of beta chains of the hemoglobin are having mutation with sixth amino acid, glutamate is changed with valine. That type of patient are called sickle cell hemoglobin patients. So see, it is very simple. On the sixth amino acid of beta 1 has mutation. Glutamate is replaced by valine. Glutamate is replaced with valine on the beta 1. Then this type of patients are called sickle cell trait. If the sixth position of beta 2 is also changed from the glutamate to the valine, then this type of patients is called sickle cell disease. So sickle cell trait is the patient who is having heterozygous mutation, and sickle cell disease is the patient who is having homozygous mutation. So sickle cell disease is the patient in which both the beta chains of the hemoglobin are having mutation, and sickle trait is the patient in which only one beta chain is having mutation. Okay, I think this point is clear for you. What is sickle cell trait, what is sickle cell disease, and what is HBS, what is HBE, what is HBC, what is HBA. There is another concept called HBF. There is another hemoglobin which is called HBF. Very, very important it is, HBF. HBF is the type of hemoglobin. HBF is the type of hemoglobin This type of hemoglobin is mainly present in fetus. Okay, when in fetus there is a special type of hemoglobin which is called HbF. In this hemoglobin, this hemoglobin has two alpha chains and two gamma chains, two alpha chains and two gamma chains. Actually, here in adult, in HbA we have two alpha chains and two beta chains. But here in HbF, in fetus hemoglobin, we have two alpha chains and two gamma chains. So this hemoglobin F has high affinity to bind with the oxygen, and it is very powerful hemoglobin. Even if the patient is in low oxygen concentration areas, this hemoglobin F can cause oxygen saturation, and it can make the patient to survive. That's why HbF is induced in the patient who is having sickle cell disease. So sickle cell disease is the patient where patient is having HbSS. In that, see, when patient's hemoglobin is HbSS, initially when patient's Hb hemoglobin is attached with the oxygen, it is normal. The RBC is normal. But immediately when oxygen is removed from the hemoglobin, the RBC will change its structure into sickle cell. It will change its structure into sickle cell. Okay. So those patients are having severe clinical presentations, like patients will have vaso-occlusive crisis, patient will have severe body pain, patient will have a lot of rupture of the RBC. Okay, hemolysis is seen. All these things are seen in the hemoglobin sickle cell disease patients. So in these patients, hydroxyurea is given, and this hydroxyurea, what it does, it will try to induce the production of hemoglobin F, which is a fetus hemoglobin, which is very similar to HbA, which is similar to HbA. That's why in sickle cell patients, HbF is induced to save, to prevent the patient from the hemolysis and to stop the patient from clinical presentations of sickle cell disease. Okay, I think you understood about the types of hemoglobins and all. Now let us try to see the mechanism of action of hydroxyurea in cancer. We all know hydroxyurea has three uses. One, it is used in leukemia. It is used it is used in radiation therapy. And third, very important, it is used in sickle cell disease. Now we are discussing about anti-cancer drugs. That's why we'll focus only on leukemia, how hydroxyurea is used in leukemia. Now see, when hydroxyurea is given, hydroxyurea will inhibit a very, very important enzyme which is called ribonucleotide reductase. Ribonucleotide reductase, RNR. This enzyme is important in the production of DNA. Actually, this enzyme is important in production of DNA. See, this enzyme converts ribonucleotides into deoxyribonucleotides, which are important in the production of DNA. So when this enzyme is inhibited, this reaction doesn't take place, and there is no synthesis of DNA, and further cell replication, protein synthesis, everything will be stopped. That's why hydroxyurea inhibits ribonucleotide reductase, and by that it kills the cells, especially in the leukemias. Okay, this is the very simple mechanism of hydroxyurea in cancer. Now, let us understand about the pharmacokinetics of hydroxyurea. See, hydroxyurea is available in oral form. It is available as oral capsules. It is available as oral capsules, and the normal dose is between 20 to 80 mg per kg. 80 to 20 mg per kg is the normal dose that can be given in the patients. Okay, and its oral availability is between 80 to 100%. Because of its good oral bioavailability, it is mainly given in oral route. It is also available in IV, but mainly it is indicated through oral cavity, oral route. And its T half is between 3.5 to 4.5 hours, and the total drug is excreted within 12 hours after its administration. Okay, and whenever hydroxycarbamide is given in kidney failed patients, the dose should be decreased initially. This is important. Okay, so these are important points you have to remember about pharmacokinetics of hydroxycarbamide. And now let us see the therapeutic uses of hydroxycarbamide, as we are discussing about the anti-cancer activity of hydroxyurea. See, hydroxyurea is given either alone in leukemia, or it is given in combination with other drugs. It is given in two dosage schedules. Okay, if it is given 80 mg per kg as a single dose, it can be given for every third day. Okay, and if it is given as 20 to 30 mg per kg, it can be given uh, once every day. Okay, so if single dose is given, 80 mg per kg is given for every third day. and if everyday dose is given, 20 to 30 mg per kg is calculated and it is given every day. Okay, so this is the normal dosage and therapeutic uses of hydroxycarbamide. Now if we see the adverse effects of hydroxycarbamide, always remember hydroxycarbamide causes leukopenia, anemia, and occasionally thrombocytopenia because it is having bone marrow suppressive action. But bone marrow suppression is not as high as other cytotoxic drugs. It causes leukopenia, anemia, and thrombocytopenia. These are major effects. And other adverse effects, it can also cause desquamative interstitial pneumonitis. It causes GI disturbances. It causes dermatological reactions. It causes stomatitis, alopecia, neurological manifestations. All these are other rare adverse effects that can be seen with hydroxycarbamide. Okay, especially leukopenia is important and specific adverse effect that we have to remember about hydroxycarbamide. Now let us discuss about L-asparaginase enzyme. L-asparaginase enzyme. This enzyme has very useful in the cancer, patients, especially in the acute lymphoid leukemia. See, all these cells in our body, they require asparagine, L-asparagine. This L-asparagine is the protein or it is amino acid. Every cells in our body requires L-asparagine for protein synthesis. Okay, so every cell in our body tries to synthesize their own L-asparagine with a very important enzyme which is called asparagine asparagine synthetase. So every cell in our body, every normal cell in our body has asparagine synthetase, and they synthesize this L-asparaginase, and with that they produce proteins, and with that they survive in the body. But always remember, the neoplastic cells in our body, they have deficiency of asparagine synthetase enzyme. So neoplastic cells will have deficiency of asparagine synthase, and they can't synthesize L-asparagine. So they depend on the L-asparagine from the blood. Okay, from the blood they take L-asparagine, and with that L-asparagine they try to survive. So one point you have to remember: the neoplastic cells will depend on external asparagine. They depend on external asparagine because they can't synthesize asparagine because they don't have asparagine synthetase enzyme. So what is the use of L-asparaginase enzyme? What is the role of L-asparaginase enzyme in cancer? Now you see, I will try to explain you the mechanism first. As we already seen, see, every cell requires L-asparagine for protein synthesis, right? And this L-asparagine is synthesized from the asparagine synthetase enzyme. This is a neoplastic cell. Neoplastic cell has no L-asparagine synthetase enzyme, so it can't synthesize L-asparagine. So what happens? It will depend on the L-asparagine which is present in the blood. From the blood, it depends on L-asparagine, and from the blood, it will take L-asparagine and it will try to proliferate. See, in this situation, if L-asparaginase enzyme is given, always remember this L-asparaginase enzyme immediately breaks down this L-asparagine which is present in the blood into aspartic acid and ammonia. The function of this L-asparaginase enzyme, is it converts the L-asparagine into aspartic acid and ammonia. Immediately it converts the L-asparagine into aspartic acid and ammonia. So the neoplastic cell which was depending on L-asparaginase from the blood will have no source. So there is no source of L-asparagine because asparaginase immediately converted this L-asparagine into aspartic acid. So in that cases, what happens? The neoplastic cell again will starve. Okay, it has no L-asparaginase for protein synthesis. So in that cases, what happens? In the absence of L-asparagine, this cell will die. It can't survive, it can't proliferate. So in that manner, the L-asparaginase enzyme converts the L-asparagine into aspartic acid, and with that it will kill the neoplastic cells. Very, very interesting and very easy mechanism of action. Now let us see the asparaginase. It is available in IV form as well as IM form. It is given. Okay, so it has TF of 1 day, so every day once a dose is given. 6,000 to 10,000 international units is given for every third day. Okay, and it is given for 3 to 4 weeks. It is not given daily, it is given for every third day. Okay, every 3 days once. Okay, and see, this L-asparaginase has some adverse effects. To overcome these adverse effects, we have a special formulation which is called Pegaspargase. L-asparaginase has few adverse effects, and to overcome that adverse effects, we have Pegaspargase. This preparation is conjugated with 500 Dalton units of monomethoxy polyethylene glycol. Okay, and its t-half is approximately between 6 to 7 days, and it is administered for every 14 days. So the advantage of Pegaspargase with L-asparaginase is it is given once 14 days because of its long duration of action, and along with this it has low adverse effects, low ADRs. Okay, so this point Pegaspargase you have to remember. Okay, L-asparaginase is similar to, I mean, this Pegaspargase is similar to L-asparaginase. Okay, now if you see the adverse effects of L-asparaginase, first adverse effect is it stops the protein synthesis, it decreases the protein synthesis. Okay, and as it is a always it is enzyme is a protein, that's why it has antigenicity, so it can cause hypersensitive reactions sometimes, urticaria, and few times it can cause anaphylactic reactions also. So we have to be very careful when L-asparaginase enzyme is infused to the body. Okay, and sometimes it causes hypertriglyceridemia, it causes hyperglycemia. Okay, it increases the protein fat level, it increases the glucose level. Okay, and it causes hypoalbuminemia. This one you have to remember. It is decreasing protein, it is increasing triglycerides or hypertriglycerides, it is increasing triglycerides, it is increasing sugar, it is increasing glucose, but it is decreasing proteins, especially albumin. This one we have to remember. And it causes pancreatitis also sometimes. And clotting problems, very very important. Due to the decreased levels of proteins, clotting factors will be decreased and patient may have bleeding also. And if anybody has intracranial hemorrhagic episodes, in that cases L-asparaginase is never advised. Very very important contraindication. Okay, so if anybody has intracranial hemorrhagic conditions, in that cases L-asparaginase is never given because it causes bleeding and it is contraindicated in this condition. These are adverse effects of L-asparaginase. Okay, I think you understood what is L-asparaginase. And about arsenic trioxide we'll discuss in next class. Okay, so yes, these are important points about L-asparaginase and hydroxychloroquine. Okay, that's it for today. We'll continue the other chemotherapeutic agents in next classes. Okay, till then we'll see. Thank you all.